This is David Pace, a general surgeon from northeastern Canada, and I'm going to talk to you about an interventional study to improve compliance with post-colonoscopy surveillance guidelines. I have nothing to disclose. So research has shown that colonoscopy is overutilized in patients undergoing colorectal cancer surveillance as well as adenoma surveillance. And this leads to unnecessary exams, leading to longer wait lists and increasing the cost of the entire healthcare system. So the aim of our study was to improve endoscopist compliance with national guidelines on post-colonoscopy surveillance. We did this by sampling about 500 patients on surveillance colonoscopies by each of 18 endoscopists working in one of 5 hospitals in our health region. The endoscopist's recommendation for the next surveillance exam was compared to the published surveillance guidelines, and from this we measured compliance with these guidelines. We then came up with 3 interventions to help improve compliance. Endoscopists were informed of their compliance rate and that of the group. A survey was also conducted to ascertain how endoscopists decided upon surveillance intervals and barriers to following these intervals. And finally, we had all the endoscopists meet with us to discuss survey results and identify ways of optimizing compliance. Subsequent to that, we measured compliance on 2 separate occasions. So what were the results? Our initial compliance rate was 72.6%. and that ranged from 50% to 100%. The 3 most common reasons for not following the guidelines were poor bowel preparation, patient preference, and booking the next procedure prior to knowing the pathology. So if somebody took off a polyp, they assumed it was an adenoma and they booked based on that, but if it came back as a hyperplastic polyp, obviously the patient was booked too soon. The health authority, having this new information, mandated split-dose bowel preparations for all colonoscopies and posted the guidelines in each endoscopy unit in the hopes that the endoscopist would read them and follow them. So what are our final results? The compliance rate in 2014 was 72.6%, and that improved to 82.3% in 2016 and maintained at a high level in 2017 at 82.1%. These differences were statistically significant when compared to the baseline compliance rate. So what we can conclude from this study is that a multifaceted intervention was associated with an improvement in compliance with colonoscopy surveillance guidelines, and this improvement persisted over time. Thank you for your attention and enjoy the meeting.